I'll start with an anecdotal story of myself. I suffered from depression in residency. It was interesting because, I think there's a lot of different factors, and, whether I was genetically predisposed to depression or whatever, that's neither here nor there. But I think that the medical field, particularly in residency, really provides, it really is a very unique circumstance in a couple of different things that I was really able to identify as potential contributing factors to my own depression. And another colleague, another resident, also suffered from. I ended up also suffering from depression. And then I think around that same year, there was a fellow or a resident that jumped off the roof of a hospital in New York and committed suicide. So the factors that I found were, first off, you're so tired all the time, right? You're sleep deprived. And like you mentioned, that can exacerbate depression, right? And then you have this magnifying glass on you because you're constantly being assessed. So you're tired, you're messing up. And, in my case, I was depressed. So that was sort of having a positive feedback loop in and of itself, right? I would mess up more. I was more depressed, more tired. And then that would cause them to be even more critical of me, right? I mean, there should be an element of resilience there, certainly, but I just got stuck in that loop. And then also, I think in residency, you're a doctor in practice, right? So you're so adjacent to really big existential concepts, right? Or at least I was, and how I was reacting to them, I was like death, right? Like a patient, like you said, like dying on your watch, thinking back on the kind of things that you could have done. And you're so adjacent to that, and you're asking all these questions of yourself. And I was doing it in the same exact time where, I'm depressed and I'm in all these other things, and I'm tired, right? So it's just like this really big mix of just like all these different things pulling me in so many different directions. I could never just ground myself and just have like my feet under me, And then I think the environment that I was in also, the third thing I think is the environment that I was in just wasn't a supportive one for mental health. And I don't know how it is now for residents or, on this side of the country. But an interesting example was I'm walking around in clinic, right? And one of the doctors that is supposed to sort of be looking after the residents, right, pulls me into a clinic room and says, let me talk to you for a second. So I'm like, okay, this is the moment, right? This is the moment where this guy asks me, am I okay? Am I not? And when I tell him that I'm not, right? And he looks at me and he says, I want you to tell me the truth. Are you on drugs?
Yeah, right.
Right? And it was like, it was more disappointment than anything else, It was just like, I'm not on drugs. I just probably meet the diagnostic criteria for depression right now, So, but that was just like an example of sort of the environment that I was in at the time. But, nonetheless, I had really great support, like you mentioned before, from family members once I reached out to them and stuff like that, and friends, and they really, really got me through it, and I'm so thankful for them, and I'm a lot better now. But, throw that into like COVID right now, right? A lot of mental stress for a lot of healthcare professionals. Have you found the same? Or?
Yeah, and if we can, I guess back in the theme of, supporting people through, medical school and residency, which are clearly can be very stressful experiences, as is the experience of being a physician. So sort of full disclosure, UCLA has a behavioral wellness center, which is mental health supports for trainees. For example, medical students, residents, fellows. Full disclosure, my wife is the director, so you can have her on at some point in time.
Yeah, totally.
She would like to talk. This is her passion, is this topic.
Sure.
It's something that we need. So medicine is moving more towards organized medicine, right? Sort of, I think, as it used to be, we had a sort of culture in medicine where we're sort of all in it alone, and set up your little private practice and stuff. And now we're pretty much all of us are going to be working for large healthcare organizations. All of us physicians, most of them are now. It's been a major sea change, and it's even more so going to be in the next few years. So it's pretty much everyone. And so now we have a system where pros and cons of that. But one of the it is possible to embed resources in these large organizations for detection, outreach, supports, that kind of thing. And I don't want to, if you're not comfortable talking with this, that's fine. But I don't know if you have thoughts on, and we can get to the COVID issue, but sort of, many people have been in your experience in residency, right? Mm-hmm. And sort of how you got through this, or was it, clearly it got, you got what you needed, right?
Yeah, I did. And interestingly, I'll admit it, man, I called my mama. I called my mom, and I told her what I was going through. And like a lot of people don't have that luxury, right? They can't just call their parents and talk to them about what they're going through, And she was able to make the appropriate appointments for me, and I went and I saw who the person I needed to see, and then got through it, right? Like, and then after that, it was like constant check-ins from my family and like constant check-ins from my friends and stuff like that. So, which really helped me get through it, right?
So it's your family, right?
Family and support. And interestingly, my colleague that ended up also having depression, it's so interesting, man, because I got through my thing, and then I started seeing this guy, and the telltale signs of some mental health issues, like start showing up late to 8 a.m. Morning presentation, right? Start showing up late disheveled to 8 a.m. morning presentation, right? Starts messing up. People start talking about him messing up, with notes and stuff. And it's the same exact thing that happened to me. So then I went to him and I said, what I wish someone would have done to me, right? Which was, you okay? Are you all right? And then sure enough, he spilled his guts to me, because I'm sure he was dying to do it, because I was too. So then I gave him the contact of someone that he saw, and then within and I checked in on him pretty frequently, and within a couple months, he had gotten through it, and it was a lot better. So it just that different perspective was just so interesting for me to be able to actually witness that.
Yeah, it's it's sort of the hero culture of medicine, right?
Yeah.
That, again, we're all kind of heroes. We're on our own. We should be able to do this. We have to be able to do this. And it's, it's just the issue of burnout. Burnout rates in physician groups are very high now. And certainly COVID was, it's been a very stressful time for everybody, but for medical professionals and for, doctors, nurses, everyone that, both in terms of seeing people die, right, and seeing people loss, and, families not being able to be together at loss. It's been, and also just the, medicine, people generally go into medicine for a sense of for the practice, right? You know what I mean? It's sort of, you actually want to help people. I know this sounds kind of corny, but, you actually want to, and this is sort of the reason I went into psychiatry, is because I actually generally believed I could help people. I could take people in a situation. There are things I could do that other people weren't doing or weren't available, and that I could make a difference in their life. Right. And increasingly, the practice of medicine is less that, right? And more kind of, charting and stuff. You see patients, right? Your inbox or whatever it is,
Yeah.
And this sort of the, sort of a lot of the sense of gratification in medicine is not, is a little harder to come by.
Yeah.